Measuring radiation. A sievert is equal to an effective dose of a joule of energy per kilogram of recipient mass. One millisievert is equal to 0.1 rem, which is another unit of measurement for radiation. Levels of radiation on the body. Millisieverts is the recommended limit for radiation workers to receive every 5 years. Chernobyl radiation today. 2 years later, 22 years later, radiation levels inside the Chernobyl reactor hall were approximately 34 sieverts per hour. A lethal dose in just 10 minutes. Physical effects of radiation. Some areas of the body that radiation affects are hair, brain, blood system, heart, gastrointestinal tract, and reproductive tract. Hair can be lost quickly and in clumps with radiation exposure of 200 reams or higher. Exposure to levels of 5,000 reams or higher can cause the brain to perform seizures or even immediate death. Radioactive iodine can destroy all or part of the thyroid gland. Exposure to 100 reams or more will cause the blood's lymphocyte cell count to be reduced, leaving the body more susceptible to infection. Data from Hiroshima and Nagasaki show that symptoms may persist for up to 10 years and may also have an increased long-term risk for leukemia and lymphoma. (1,000 to 5,000 reams of radiation will do immediate damage to small blood vessels and cause heart failure and death directly. (200 reams or more will do damage to the intestinal lining and cause nausea, bloody vomiting, and diarrhea. Levels of 200 reams or lower can result in the victim becoming sterile if they have radiation sickness. According to a NASA study, there are also mental abilities such as learning and memory that can be affected by radiation. After shooting small doses of radiation into mice in space, researchers noticed learning and memory abilities were affected after 6 weeks of exposure. Some positive uses of radiation are X-rays, radiation therapy, smoke detectors, carbon dating, and security. Due to their ability to penetrate certain materials, X-rays are used for a number of non-destructive evaluation and testing applications, mainly for identifying flaws or cracks in structural components. Sending radioactive material throughout the body, doctors can look at the radiation coming out and determine all sorts of important things, like organ function, blood flow, and even detect certain cancers. Many smoke detectors utilize a radiation-emitting substance, americium-241, to sniff for smoke. When the smoke breaks the radiation stream between the americium and the detector, the alarm will sound. Carbon-14 breaks down radioactively over time at a constant rate, so scientists can use the carbon-14 isotopes to determine the approximate age of things such as dinosaur and human remains. By utilizing ion mobility spectrometry, X-rays are able to smell the trace elements found in most explosives.